this is Bianca Martinez, and I'm going to be doing my video demonstrating how to insert IV. I'm going to begin by looking up in the MAR that the provider has ordered for an IV catheter to be inserted into the patient. Once I confirm that it has been done, I'm going to begin by grabbing all my materials that I'm going to need. I'm going to head over to the patient's room, begin by knocking on the door, providing privacy for the patient, and I'm going to do hand hygiene. I'm going to introduce myself to the patient. Hi, my name is Bianca. I'm going to be your nurse for today, and I'm here to insert an IV that your doctor has ordered. Once I let them know what I would be doing, I'm going to do my second check by confirming their information and looking at their medical band. If they're able to let me to confirm their name and date of birth, I will have them repeat it to me. Once that has been done, I'm going to go ahead and apply my gloves. I'm going to clean the site with an alcohol prep pad for about 2 minutes and deep cleaning it. I'm going to wait for that to completely dry. I'm going to open up all my materials and have it prepped for me. Since I don't have an exact arm, I'm just going to verbally say that I would be using the tourniquet and tie it around the patient's arm so I can see the veins pop up. But you don't want to leave the tourniquet on too long. That way you do not have any hemolysis in the IV and it would not work properly. So once I have seen that the site has dried, I'm going to go ahead and grab my IV catheter. When inserting it, you want to make sure that the bevel is up. I don't know if that would make it easier to see. I'm going to tell the patient to take a deep breath so they can relax as soon as I'm inserting it. Okay, deep breath. Once I see the gush of blood, I'm gonna start retracting the needle out while holding it in place. Sorry, I did not realize that was gonna go in so quickly. Once I see that it has not moved, I'm gonna go ahead and use the tape to tape it up. So you want to stabilize the catheters. Tape got stuck on my gloves. I apologize. Once you have put some tape to support the IV, you're going to go ahead and use the Texiderm to hold it. This is going to protect the IV from moving. And these are actually good that once you remove it, you're able to initial and place the date for the IV. I'm going to go ahead and attach my tubing. Use some saline to make sure there's proper blood flow. Okay, so you want to push in a little bit of saline, and if it would be a patient's arms, I would pull it back a little bit and make sure the blood would come through. Once I have done that, I'm going to go ahead and close this. And it's important to initial and date the IV site. Once that is done, I am going to grab all my equipment that I have finished using. Any sharps containers, any sharps, you want to make sure you put in the container. Grab the garbage and throw that into the garbage can. And that's my video for inserting an IV.